Bismillahirrahmanirrahim. This is our second lecture on active assisted exercises. Previously, we discussed about the definition of active assisted exercises and where we can use the active assisted exercises. And we also discussed the indications of active assisted exercises. We discussed about the types of assistance, mainly two types of assistance, manual assistance and the mechanical assistance. We discuss the techniques of application of active assisted exercises, and we discuss the starting position, fixation, support of the part to be moved, and the antagonistic muscles, traction of the muscles prior to the exercises, characteristic of active assistive exercises, their directions, repetitions, patient's cooperation, understanding the pattern of movement and the character of the movement. And we left our previous lecture at types of assistance. Today, from now onward, we will discuss about the meaning of active assisted exercises. Types of assistance, as we discussed earlier, that there are mainly two types of assistance. One is manual assistance and the other is the mechanical assistance. Manual assistance further divided into two types: self-assistance and the therapist assistance. Self-assistance, when a patient has unilateral weakness or paralysis or paresis, he can be taught to use his normal extremity to move the affected limb through range of motion. And this type of assistance will be called as the self-assistance or auto-assisted exercises. Therapist assistance, when a therapist is giving the force of assistance to complete the range of motion of a joint, in addition to the muscles effort, it is called as the therapist assistance. The movements are done by the therapist assistance, but by the therapist, but not by the therapist completely. If the movements are carried completely by the therapist, then it will become as the passive exercises. But in the active assisted exercises, we have to augment the contraction of the muscles, and for the completion of the range of motion, we have to give some assistance to the patient. If the patient is not contracting his muscles and the external force is carrying the joint throughout the range of motion, then it will become the passive exercises, passive movement. It will not be called as the active assisted exercises. The second mode of assistance is the mechanical assistance. How we can give the mechanical assistance to the exercises? Number one is the band exercises. Band exercises, you see in many gym exercises that the person is handling a stick, and by the assistance of he is performing the exercises through these band or these sticks. This is called as the band exercises. A wooden stick can or similar objects may be used. Number second is the finger ladder. In the next slide, I will show you these things, that what is band, what is finger ladder, and what are the other pulley and pulley circuits, pulley and weight circuits, and the shoulder beams. Finger ladder, with wall climbing are tools used to assist the shoulder and the hand movement. Number third is the cord and pulley or weight and pulley circuit. Provide assistance for shoulder, elbow, and wrist range of motion. Number four is the shoulder wheel. provide assistance for the upper limbs. Skateboard and powder board. A board is placed under the affected limb to assist. Number one, isolate the effect of gravity. What will be the work of that skateboard or powder board? It will spare the effects of the gravity, and it helps post-surgery cases where there is decrease in the muscle power and muscle needs some assistance, and weak muscular contraction is unable to complete the range of motion, and if the motion is carried on a skateboard or over a powder board, less muscles effort is required to complete the range of motion, so that this powder board or skateboard is assisting to the movement. After removal of plaster cast, where there is the plaster cast over the limb, after the removal of that plaster cast, the muscles underwent weakness, and after the removal of this cast, muscles are unable to complete the range of motion because they are immobile in the plaster cast for a period of time. There is no paralysis of the muscles, there is no pathology of the muscles, but due to the immobilization of that part, the muscles becomes weakened. So that after the removal of that plaster cast, patient is unable to complete his range of motion. In this condition, the skateboards, the powder boards are helpful for the weak contraction of the muscles to accomplish the range of motion of the joints. Suspension. Suspension is also a type of assistance. The involved segment is suspended in a sling attached to a rope fixed to a point above the body segment, and we carry the exercises after that. After the suspension of that part into a suspension apparatus through slings, after suspending the part become lighter than before, and the less power of the muscles would be sufficient to bring about the range of motion of the joints. Reciprocal exercises unit. Reciprocal exercise device is a device used to provide some hip and knee flexion and extension to an involved lower limb by the use of the patient's sound side or patient's normal side. This is the this picture is the reciprocal exercising unit. In this unit, we can assess the movement of the affected part or affected side of the patient by the help of the sound or normal side of the patient. And this one is the finger ladder. This one is the pulley and weight circuits. And this is the example of the suspension therapy or suspension apparatus. This is an other example of the rope and pulley circuit. This is the rope and pulley circuit, and this is the wand. In the hands of the people is the wand. This is the wand exercise. This is shoulder wheel. Now we will discuss about the effects and uses of the assisted exercises. Active assisted exercise increases the working muscle efficiency. The working muscles cooperate in production of movement which they cannot achieve unaided. These muscles will gain strength and hypertrophy by the time, and when we keep on exercising, the working muscles will gain the power and endurance, and they are hypertrophied after the repeated exercises, and will help in performing the activities of daily living and the other things which are required by the patient. Sometimes when there is paralysis, the muscles are not paralyzed completely, but they are paralyzed, but a part of them is paralyzed, and the remaining power of the muscles can be augmented, can be uplifted to perform the work of the whole muscle, and this is can be achieved by the use of the active assisted exercises. The remaining power of the muscles, the remaining muscles which are in working condition, we can augment their power to fulfill the job of the whole muscle. When uh, that is the work which was performed previously by the whole muscle, and now a part of that muscle is paralyzed and a part of that is in working condition. The working condition muscles can be uh, augmented, his power can be augmented to that level, he will be able to perform, or he is near to perform the function of the whole muscle. And this can be achieved by the active free exercises. Active free exercises increase the range of movement. The range of effective joint movement increased by assisted exercises, as both range and control are often dependent on the efficiency of the efficiency of the muscles. Efficiency of the muscle working over that joint. When there is decrease in range of motion due to weakness of the muscles, we can achieve the that efficiency in decrease of range of motion by increasing the power of the muscles. When the muscles gain their power, they are able to complete the range of motion which they are not capable of doing before the active assisted exercises. When by the active assisted exercises over a period of time they gain their power, they are they become able to complete the range of motion of that particular joint. Memorize the pattern of movement. The memory of the pattern of coordinated movement is stimulated by the correct performance of a movement which the patient is unable to achieve without assistance. When a patient is unable to perform the activities in a pattern of movement, and by the time the movement memory has been lost from the nervous system, and if we continue exercising that pattern by the use of the active assisted exercises, by the use of the assistance to the uh, weak muscles, then we could be able to memorize the pattern of movement of that particular part. If patient is unable to perform his movement by the help of his own muscles, and for a long period of time that movement is not carried about by the patient, then it may be possible that he can forget the pattern of movement. If the muscles remain inefficient, muscles cannot work efficiently to perform that pattern of movement, so that the active assisted exercises are helpful in memorizing the pattern of movement. Relearn pattern of movement. If a pattern of movement has been lost from the nervous system, it is forgotten by the nervous system, it could be relearned by the active assisted exercises. Frequent repetition of correct pattern with gradual decreased resistance helps to relearn the pattern of movement and the control over the movement. When the muscles gain their power by the repeated use of the assistance and by the repeated use of the exercises, when they got the power back and we reciprocally decrease the assistance to the movement, then muscles are finally are capable of doing that movement without the assistance, without any assistance. And in this movement, and in this matter, they'll relearn the pattern of movement. And if we could not, we should not provide the assistance to the muscles, the pattern of movement can be lost from the nervous system, and it could be forgotten by the muscles. But by the use of the assistance to the contracting muscles and by achieving the full range of motion of the joints, the pattern of movement can be memorized, remain memorized, and could be relearned after their loss. Improve neuromuscular coordination. Conditions of impulses, conduction of impulses is facilitated in the neuromuscular pathways, which increase the neuromuscular coordination. When a movement is brought, it is controlled by the nervous system. It is bring about by the nervous system, and contraction of the muscles is controlled by the nervous system. When the muscle is going under the full range of motion of a particular joint, the pattern of movement can be sustained, the pattern of movement can be relearned if lost, and pattern of movement can be memorized. And what are these conditions? We are coordinating the neuromuscular system with each other. By memorizing the movement, by relearning the movement, we are increasing the neuromuscular coordination, because muscles are nothing without nervous control. If muscles are intact, there is no pathology in the muscles themselves, but there is no nervous control. The nervous system is failed. The nervous system is down. In this condition, muscles are not capable of any type of movement. So that by by the use of this assistive active assisted exercises, the neuromuscular coordination is improved, can be increased. Increase the confidence of the patient. Confidence in ability to move is established when the patient observes that movements and the fact that his muscles are cooperating in producing the movement. Throughout the sport of limb during movement encourages to put maximum effort to achieve the movement. After paralysis, when patient thinks that and patient thought that he lost his nervous system and now he is unable to do his daily living, he cannot perform or move his muscles, his joints. But when we start the physiotherapy, when we start the exercises, and we boost the remaining part of the neuromuscular system to, to decrease the effects of paralysis, and by the time when patients see that, when he saw that his movement are, he is able to do the movement by the contraction of his own muscles, and he can complete the movement by the assistance of some external force, he gain confidence. When when he see by his naked eyes that his limb is moving by the contraction of his own muscles, although this contraction of muscle is not capable of completing the range of motion, but it will encourage his efforts. It stimulate the effort of the patient that he can be able to bring the changes in his nervous system, in his neuromuscular system. And when patient confidence increases, his interest in the treatment, his interest in the exercises is increased. And when we gain the patient's interest, when we gain the patient's efforts, then we can be able to bring the maximum results of the exercises.